Now that we know how is the PCI done, then how is the complex PCI like chip is done and what is protected PCI, what is most important also is procedure is done, that is not the end of the story. In fact, that is the beginning of the story for the patient. The patient needs to be extremely careful, and immediately in the post-procedure first 24 hours, we need to monitor these patients in ICUs, monitor their rhythm, how the beating of the heart is happening, monitor their blood pressures, vitals what we call, and the puncture site, whether it is radial artery or femoral artery, needs to be monitored for the first 24 hours. Once this acute phase is over, then patients are discharged the next day, and probably immediately post-procedure at home also, patients need to be given most important drugs which are called as antiplatelet drugs. Apart from these antiplatelet drugs, what is also important is giving high dose statins, that is cholesterol lowering drugs, which actually not only lower cholesterol but also prevent the renarrowings happening within the stents. So antiplatelet drugs and the statin drugs are the most important, which needs to be given to all the patients. But suppose by and large, if the patient has any associated diabetes, blood pressure, he needs to be taking treatment for those also. Very rarely the procedure is done after the pumping becomes less. Then we also give drugs like ACE inhibitors, receptor blockers. Now we give actually sacubitril valsartan to improve the pumping function of the heart. So it's very important to control the risk factors, and again to see that again the secondary problems like restenosis, renarrowing should not happen, which we call as secondary prevention. So after somebody suffers a heart attack, the procedure is done, we need to follow carefully the principles of secondary prevention and then prevent renarrowings and repeat problems happening in these patients. And patient needs to follow dietary precautions also as advised. Avoid too much of fatty foods, too much of sweets, take salads, vegetables, and then do gradual exercise, what we call as rehabilitation, and then maintain your activities, yoga, meditation also will help. And never touch cigarettes or alcohol, and take all the medicines as per the doctor's advice. If you follow all these precautions, then probably the stents are supposed to last longer, or neither stent or bypass surgery a requirement again and the follow-up will not be there to these patients. So it is very important for the patients not to neglect their health, stop taking drugs after these procedures are done. But it's equally important for the patient to be compliant with the medicines and come to the regular checkups as advised by doctor.